Our mobile crisis teams are trained professionals able to support someone in a moment of behavioral health crisis, whether for mental health or substance use needs. Anyone in our county can call 988 or a regional crisis line to get the help that they need. For some, that might mean text or someone to talk to in a moment of behavioral health crisis. For others, they might need someone to respond. And that's where our behavioral health mobile crisis teams pick up to be able to connect with that person.
We try to respond as soon as possible. As soon as we get the call, respond within 5 minutes, within 10 minutes, as soon as possible, get out the door. We talk to them, hey, give them a disclaimer. So I would say, hi, my name is Chris from the Mobile Crisis Team. We were called due to your need of supportive emotional support and anything else we could assist you with. And from there on, depending on what the client needs, is how we will approach the call in that given moment.
Having your mobile crisis teams means that trained behavioral health professional can respond to someone's crisis. They're able to meet them there in that moment and respond to whatever their behavioral health needs are. Thanks to our King County voters, the Crisis Care Center's levy has allowed us to expand our mobile crisis teams. That means that we are able to add 12 new teams for a total of 32 teams across the county, both supporting adults as well as youth.
Number one, it helps the clients experiencing crisis. It also assists police, fire. People may not always take into account that it is hard for a lot of people to trust someone like myself or someone else from the system. Many people on our team and other similar teams work extremely hard trying to build trust, rapport, trust enough to share what's going on or their perception of what's going on.
Starting in December, we'll have our expanded teams with locations all across the county to be more available and responsive to the community's needs. If someone is in a behavioral health crisis, they can call 988 or our regional crisis line, 206-461-3222, and Crisis Connections will be able to connect them with a team that can come to meet them. Help is available.